Every man over a certain age is concerned with cutting the risk of prostate problems. So when a world-ranking health scientist tells you how to do this, it's worth listening.
Well, when it comes to prostate issues, the two sort of major areas of concern would be benign prostatic hyperplasia, which is a non-cancerous growth of certain parts of the prostate, which can lead to obstruction of urinary flow. And then, of course, the thing that every male is most worried about, prostate cancer. So there does seem to be an increase in benign prostatic hyperplasia. Now, this seems to refer to a situation where you're getting increased rates of prostate cell growth which are not counterbalanced by increased rates of prostate cancer dieback. So over time you're going to get an increase in mass. Normally these processes should be in balance. If you're starting to increase growth and reduce programmed cell death, you get an accumulation of tissue.
As Dr. Clayton was saying, it's entirely normal for millions of cells every day to be growing and to be dying back. But it's when that balance between growth and dieback, which is normal, is affected and there are more cells growing than are dying, then of course you get a buildup of cells which enlarges, in this case the prostate, puts pressure on the urinary tract, which in turn causes the stress of more frequent urination and indeed more serious problems.
It looks as if an environment in the body that's broadly pro-inflammatory may be one of the factors that upsets that balance and may contribute to BPH. Then there are certainly a number of dietary factors which contribute to programmed cell death, including many of the polyphenols or flavonoids. Some people sort of conflate flavonoids with polyphenols, but flavonoids are a subset of polyphenols. So these are plant food derived compounds that we ingest and which seem to play an important role in programmed cell death. And it may be, in fact I'm rather persuaded by the fact that our reduced intakes of these compounds that we've seen over the last century, last 50 years, may be contributing to an increased incidence of BPH as well. I think just more fruits and vegetables in general is probably a good thing, and an anti-inflammatory environment. As far as prostate cancer is concerned, one of the issues that I'm particularly concerned about are foods, and particularly high protein foods that are cooked at high temperatures, so barbecued foods and grilled foods and things like that. They produce compounds known as polycyclic aromatic hydrocarbons, and they have been shown to increase the invasiveness and the aggressivity of a number of cancer cell lines, including prostate cancer cell lines. So this is another argument for cutting down on fast foods and high temperature cooked foods. In terms of supplements, well, a lot of people work with lycopene. Some work was done at the Karamanos Cancer Institute, I think, which is in Chicago, giving prostate cancer patients pharmacological doses of lycopene over relatively short periods of time, and that undoubtedly was effective in killing off quite large numbers of prostate cancer cells in the tumor mass, reduction in tumor mass. So I think that by modifying your lifestyle, you can undoubtedly reduce the risk and indeed the progression of prostate cancer. There's a big role for diet to play here. Here again, this is a situation where although you've got a number of components, nutrients that they've become the poster children for nutrition and prostate. Yes, it's fine, you should probably be looking at those, but don't take them in isolation.
Now, Dr. Clayton quite rightly said you need a wide range of nutrients for a healthy prostate, not just lycopene. And the reason is this. What is called chronic subclinical inflammation is now seen as the underlying cause of age-related diseases. Now, not just prostate problems, but a whole range, and that's confirmed by authorities. Low-grade inflammation of this type is associated with everything from heart disease and diabetes to Alzheimer's and arthritis, and may even be the cause of most chronic diseases. So reducing the risk of prostate problems also reduces the risk of other age-related diseases. The Scientific American says, this type of inflammation is an underlying contributor to virtually every chronic disease, including arthritis and diabetes and depression and heart disease and stroke. And the connection now between inflammation and cancer has moved to center stage. And as Dr. Clayton himself says, if this type of chronic inflammation is allowed to run unchecked, tissues become dysfunctional and then fail. And that's basically a definition of aging and, of course, age-related disease. And unfortunately, if you're approaching 50 and over, you will have accumulated damage from this type of inflammation. So it follows that reducing chronic subclinical inflammation, which will reduce risk, you need high levels of anti-inflammatory nutrients in your diet and indeed in a supplement, which is why Dr. Clayton is emphasizing the need for foods that are high in anti-inflammatory nutrients, and why he's co-written a cookbook featuring anti-inflammatory nutrients and recipes, and why he has also designed a supplement, which is called NutriShield, which not only combines lycopene with other carotenoids like lutein and zeaxanthin, which are associated with prostate health, but also includes flavonoids from things like green tea, curcumin, and grapeseed extract, which are anti-inflammatory, and soy isoflavones and omega-3, again a high anti-inflammatory, plus optimum levels of vitamins and minerals. NutriShield is a culmination of over 30 years of research by Dr. Clayton, and it combines lessons from the latest medical research with his long-term research on what are the nutrients in the world's longest lived and healthiest peoples. Go now to NutriShield.com to see how this product can help you.